Cece Ducette works with schools, communities, municipalities, and legislatures to address wireless radiation in public health. She is Education Services Director with the international nonprofit group Wireless Education, and she has a master's in professional writing.
Welcome to Session 4 on U.S. state and local policy review as well as case studies. And my name again is Cece Ducette, and that MTPW just means I had the privilege of earning a Master's of Technical and Professional Writing from Northeastern University. And I am the co-founder of Wireless Education, which is a nonprofit educational charity to teach people how to use technology safely. I've also been able to co-found Massachusetts for Safe Technology. And I was so honored to be asked to go down to the National Institutes of Health, where I co-chaired the technology panel for the Health in Buildings Roundtable Conference. And we were so grateful to be able to teach doctors and hospitals and urban planners and architects and builders about creating safe technology inside the built structure. And then I was able to help with the 2019 medical conference as well. And that is based on inroads that I've been able to make here in school and public policy. And that's what we'll spend most of our time speaking about today. But one thing that we should all be very aware of is the legal fine print that comes with all of our devices. So anybody with us today who has an iPhone, I invite you to bring out your iPhone right now, and I will have you go into the settings. So for anybody who doesn't use an iPhone, if you use an Android or another type of phone, this information is available through the Environmental Health Trust on their See the Fine Print page. They cull out a lot of the fine print from many of our devices. So for those who are following along with an iPhone, scroll down just a little ways and hit General. And on an older phone, you would hit About at the top. But most people by now will go right from General all the way down to Legal and Regulatory and hit that. And then you'll see a short little list up at the top. And 5 or 6 down, you'll see RF exposure. When we look at the radio frequency radiation exposure fine print, it tells us a couple of really important things. One is it recommends we keep this device at X amount of distance from our body. And 2, it tells us to use a hands-free option, because by simply using this device as it is given to us, we are now exposed to microwave radiation from 5 or 6 separate antennas that are continuously pulsing for an independent signal with the nearest cell tower or the nearest router. And today's message and throughout the conference is not no technology, but rather safe technology. So as I began to do my investigation, I kept thinking, surely, if this is as bad as the science is telling us, somebody must have our backs on this. And it wasn't until 2015 when Harvard University Law School Center for Ethics published this report on the bottom right here called Captured Agency, How the Federal Communications Commission is Dominated by the Industries it presumably regulates, that I finally had my aha moment. Because what Captured Agency tells us is that the wireless industry is by and large using the tobacco playbook. If you can suppress evidence of harm, if you can create studies done under your own conditions that show no harm, if you can use your lobbying power and might at the regulatory level, and then if you can dominate the media, then you can continue to perpetuate the messaging around your toxic product. And who would be the wiser? So Captured Agency was my missing piece and is what gave me the courage to go out and start having these important conversations with my own communities. And what we've also discovered subsequent to that is that the Food and Drug Administration here in the United States also appears to have conflicts of interest. And Dr. Jeffrey Shuren, who runs the radiology area, it turns out he recently advised the FCC to keep doing what they're doing with these toxic levels of exposure. And it turns out that he is married to a woman who's a partner in a law firm that represents the wireless industry. So we have a lot of work to do at the federal level, but at the school level, I used to help run our local education foundation. And I spent 8 years bringing wireless technology into our schools, from wireless infrastructure to iPads and Chromebooks and smartboards and minis and Apple TVs. And then one night at book group, a girlfriend of mine who's an electrical engineer tipped us off that there could be something up biologically with wireless. So that's where I began to do my investigation. And I got way in over my head. There was more information that I could remember where I saw it. So I just built myself a simple research repository called Understanding EMFs. And anywhere in my presentation where you see an underline, you are welcome to go into the file that will be provided, and you can drill down and find the information that we're speaking to. So when I brought this to my schools and they read that legal fine print, they did this to protect themselves legally. We became the first in the United States to have this little sign hanging in our classrooms advising everybody to turn off the devices when not in use, to turn off the Wi-Fi, the infrastructure, when not in use, and always use a mobile device on a solid surface, because even the fine print tells us not to put it on our body. So we became the first in the nation to do that. And subsequent to that, Theodora Scarato with the Environmental Health Trust and others worked with the state of Maryland, which then became the first public health agency to recommend that we hardwire our schools and do not expose the children to radio frequency radiation. We held an expert panel forum here in Massachusetts called Questioning the Safety of Our Children's Exposure to Wireless Radiation in Schools. And those are excellent videos that anybody can share with their own schools. You will hear from Frank Clegg, who's the retired president of Microsoft Canada, who gives information from an industry perspective that we should not have radiation in our schools. We also hear from Dr. Martha Herbert, who founded the Autism Lab at Massachusetts General Hospital. We hear from Dr. Ronald Melnick, who was the senior toxicologist scientist on the U.S. National Toxicology Program study that confirmed clear evidence of cancerous tumors and DNA damage, and Theodora Scarato from the Environmental Health Trust. So those are excellent to use with our schools. But here's the kicker. So the New York Times did a 3-part expose on what Silicon Valley executives are doing with their children. They are sending their children to schools with no technology, and they're making their nannies sign contracts that there will be no screens around their children, yet they have worked at the state level to force this toxic technology into our schools. Dr. Tony Stein worked with the U.S. Collaborative for High Performance Schools, and some of you may know that they have criteria for classifying schools as green and healthy, and she worked with them to come up with a set of low EMF best practices. So we don't have to reinvent the wheel. A lot of this work has already been done, but we need to bring this information forward to our schools. And there's a set of safety recommendations for study at home. Russian scientists tried to warn us as early back as the 1960s that we should not be bringing radio frequency into the commercial space, and they have gotten a jump on us yet again during the pandemic. They have a set of recommendations to keep our children safe while we're studying at home as well. So people are welcome to go out and read those. And then this little nonprofit, Wireless Education, has a schools and families online course that can be completed in about a half an hour. So the training off the shelf is available to bring everybody up to speed in the community. The teachers, the administrators, the students who are mature enough to process the information, as well as the families. So these resources are here for all to take advantage of. I want to give you a sampling next of actions that municipalities are taking. For example, the City of Boston has filed a formal comment with the Federal Communications Commission indicating that they believe the public that these radio frequency limits that the FCC has stood behind for decades now are not safe. In one town here in Massachusetts, citizens brought this forward to their municipal leaders, and in their zoning bylaws, they have negotiated a 1,500-foot setback from our homes and 3,000 feet from schools. And this is based on the science. In Burlington, Massachusetts, they became the first to adopt a small cell policy that said not only the traditional things like it has to be compliant with the Americans with Disabilities Act, because you can't put up these small cells and pretend like that's all there is, because somewhere to power that, there is a refrigerator-sized box or two on the sidewalk, and you can't put that where it would block somebody in a wheelchair from going by. And then what Burlington did is they said, you can't come into our community and just drop and run with this equipment. If we give you permission, then you have to come back every year and recertify that that technology is still viable. And we as a town don't have the funding to hire an independent consultant to oversee that recertification. So the equipment vendors are going to have to pay our town a fee so we can do this annual recertification. And when the town of Burlington ratified that small cell policy, the Verizon lawyer was present and said that my client does not wish to set a precedent for either an annual recertification or a fee, because mind you, the industry would like to put millions of these antennas every 2 to 12 houses outside your home, all over the United States and in the highly technological European countries and elsewhere in our world. So they don't want to be assessed with a fee of any kind. So 5gcrisis.com is one of the projects by Doug and Patty Wood, and I know Doug is going to be speaking with you more about this, but they've come up with a bylaw or a sample ordinance that any of our communities would be wise to take to your town lawyer and start looking at it so that we can protect each one of our communities. Easton, Connecticut this past spring, put a ban on 5G until it can be proven safe. Hawaii County voted on a resolution to ban 5G until it can be proven safe. And then another municipal action that we were able to set a precedent for in my town is to take one of the radio frequency detection meters and put it on loan in our public library so that anybody in the community with a library card could take it out, go home and remediate. And just, you know, when there's radiation, you can hear it and see it. In my home, I've chosen hardwired technology so that I don't expose myself and my loved ones to this radiation. But I want to give you a quick sample of what this radiation sounds like because it's an invisible toxin. So this is the radiation coming from my cell phone. And this is pulsing that radiation 24/7. Unless we make the choice to measure and remediate. So I generally, as a rule, keep my cell phone in airplane mode, so I'm going to put it back in that. But what I want to also share with you is what's happening at the state level. Here in Massachusetts, we had 20 bills this past session to address these man-made radio frequency radiation exposures. What I had to do was meet with my senator. I showed her the radiation coming out of her cell phone and her district director's laptop. Both devices went right off the charts. And so she put me with a lawyer in her office and we crafted a bill back in 2014. And I didn't understand how their process works, but you go through several committees before it gets voted on, then it's got to be voted on by the House and the Senate, and then it would go to the governor's office to be enacted. So here in Massachusetts, as I mentioned this last session, we had 20 bills, and even during the pandemic, even during the racial justice movement, where their time was so stretched, because we were able to present them with the facts, because experts from around the world took the time to send in testimony, we actually got 3 of these bills advanced. This was the bill that I introduced. This consumer protection bill would form a commission to bring the right minds together at the state level, investigate, and then decide what to do. We also have a bill that would give people the right to choose not to have a toxic utility meter mounted on their home to gather their usage of gas, water, and electric. And then there was another one to address fairness on forming a 5G task force to make sure economically one of the vendors is not taking advantage of any of the others, we've asked them to up that bill to include language to protect health and environment as well. We also had child protection bills, school safety bills, and also, as you've learned during this conference, the high voltage power lines are another issue. So, but what I want to spend a good amount of time speaking about is what happened in New Hampshire. This is groundbreaking. Many of you may have seen the award-winning film Generation Zapped, which is chosen as part of the United Nations Film Festival. It was awarded Best Documentary at the DC and the Women's Independent Film Festivals. If you haven't watched it in 74 minutes, it's a lovely way to learn about this issue. And we held a screening here in Massachusetts, and a woman from New Hampshire came down and watched it with us. And then she went back and shared her story of how she became so very ill. She shared this with her state representative, Patrick Abrami, and he's an engineer. And in his training, you would be taught that you have to have heat from a radio frequency emitting device in order to have harm. So what his constituent was sharing flew right in the face of what he had been taught. So he actually went and did the deep dive, and he had this major wow moment, like, wow, what are we doing radiating the public? So he wrote a bill. Deb introduced me to Rep. Abrami, and then they came down from New Hampshire to my home in Massachusetts. We sat around my kitchen table, and I was able to help him connect the dots further on why we need to address the radiation issue. So he wrote this really good bill that has a set of questions that demand answers. And he got Dr. Thomas Sherman, who's an active physician, to co-sponsor the bill with him. And then we were able to go in and testify. Dr. Paul Heroux, who's presented in this conference, came down from Canada. The retired president from Microsoft Canada, Frank Clegg, came down and joined us. And then citizens from throughout Massachusetts also testified. They got that bill passed into law through the House, through the Senate, through the governor's pen within 7 months' time. And in that law, they have answers that questions that must be answered. First of all, why has the insurance industry put exclusions to this radiation in their policies? So when our towns sign a contract with the industry, we need to be very clear on whether there's a radio frequency pollution clause that leaves our towns responsible for damages. Also, that fine print we looked at, why is that even there? And then why does the FCC continually ignore thousands of peer-reviewed studies showing harm at the non-thermal, non-ionizing level? And why do we allow 100 times more radiation exposure to our citizens and our children than other countries do? Why are they ignoring the World Health Organization advisors who are saying we now know enough to classify this as a group 1 carcinogen? And why is the WHO itself ignoring the international scientists' appeal? And one of the answers that we know is there are 2 groups at the World Health Organization that address EMFs. One is industry-backed, and the other is with the independent scientists doing the true investigation. And then how come nobody's looking at the cumulative effect? What are we doing to our children when we put them in a classroom with 30 transmitting tablets, 30 cell phones, the wireless access points in the ceiling? So we need answers to these questions. So New Hampshire formed a commission, and they asked that they have somebody from their medical society who specializes in environmental medicine and is familiar with electromagnetic radiation. They also asked to have somebody from academia. And then they also had their Department of Health and Human Services sit on this commission. And then a member of the public, and the woman who was selected, Denise Riccardi, had already fought off a cell tower in her community, so she was very well versed in this. There were also 3 additional engineers on there, and they also had their Attorney General's office on this commission, as well as industry representatives, so we can for once get everybody at the table. So they did. They brought in qualified independent EMF experts. The industry got to bring in their experts as well. And their final report was issued November 1st, 2020. And they answered the questions. And so that is there for everybody to share. And they are calling out the industry. They are calling out our government agencies as captured agencies. So we need to take charge of this at the state level and get our federal delegates to take care of this. They have meaningful recommendations, including getting our delegates involved, but also transitioning our schools to hardwired technology and turning off the radiation in all of our public spaces as well. Labeling any kind of infrastructure that has any kind of transmission coming from it, and also protecting our environment. That report, in the first 15 to 20 pages, you'll see the recommendations. Most of the report is dedicated to the appendices, where you'll find the backup information for every recommendation that's in there. So the industry did put in a minority report, and in the very last set of minutes from these meetings, Denise Riccardi and Paul Haru add information to balance out what the industry is saying, to share facts to counter the disinformation. So please know all that is there, and so your state or your country can follow suit with what New Hampshire did. So right on the heels of New Hampshire, Oregon got a law passed. And when the constituents brought this issue to Senator Laurie Moniz Anderson, she is a retired public health nurse, and it didn't take her long to look at the science and connect the dots. So she got a law passed again within a year to investigate the non-industry funded science, and experts came in and testified on that. You can see those testimonies at that link. And the Oregon Health Authority was tasked with investigating not the industry spin, but the non-industry funded studies, and especially report back as it impacts children and children in the learning environment. Their final report was going to be issued the first week of January, and we are very hopeful that they did true due diligence on this. You can go out to the Oregon State Legislature and you'll be able to find that report there. So please know that this is happening all across our country. Biological and social and emotional impact laws are being introduced in many of our states, and you can find those as I see them. I track them in my personal research repository, Understanding EMFs. And then, of course, the Environmental Health Trust also is putting up a lot of information as it becomes available. So let me give you an example and use Massachusetts as a case study for what other state agencies are doing. Back in 2016, after my bill was first introduced, Dr. Deborah Davis had brought a panel of world-leading experts to the Massachusetts State House, actually in the summer of 2015. And after they presented, they also met with our Department of Public Health, and they said, yes, we do want to address this issue. But when 9/11 hit, their budgets were cut. They lost 2 epidemiologists, and they were just getting funding back in 2015 to staff up again. So we knew it would take them some time. And then by the time the summer of 2016 came along, I was getting very nervous that we were about to start another school year radiating our children in our public schools. So as a technical and professional writer, I reached out to our Department of Public Health and I said, you know, I've had the privilege of connecting with many of the world leading experts on this. And would it be of service to you if I took something like your 4-page lead in drinking water fact sheet and hollowed it out and turned it into an EMF or electromagnetic fields fact sheet? And they said, thank you very much. That would be great. So I did. So I created a fact sheet that was 4 pages, and we went through a couple review cycles, and then they said, we're going to take it from here. They ran it through the next management level, and they said, you know what, let's create a series of 4 fact sheets. Let's do it from the point of emissions. So let's do a cell phone fact sheet. Let's do a cell tower fact sheet. Let's do a Wi-Fi fact sheet and a high voltage power line fact sheet. And I said, great, you know, the more the merrier at this point. And when might we have those? And they said, it'll probably take about 3 months. to get these out. And I said, okay, thank you so much. So then 3 months came and went. And then in 2017, Dr. Joel Moskowitz from the University of California at Berkeley, he knew that back in 2009, there was a fact sheet that had been issued or written, but never issued, and they wouldn't give it to him. So he wound up getting lawyers at Berkeley to pro bono for him. They sued the California Department of Public Health, and the court upheld that they had to release that fact sheet. So Dr. Moskowitz knew I had done this fact sheet with Massachusetts, and he did a Freedom of Information Act request. And our Department of Public Health said, well, we don't have to give that to you because it's still in draft format. So Dr. Moskowitz went over to the editor of the Boston Globe and said, you may be interested to know that your Department of Public Health is sitting on information that's critical to public health. And so finally, the Boston Globe assigned their tech reporter to do an article on this. And in that article, the Department of Public Health said that they would have those fact sheets out within 6 months. Well, within 3 weeks of that article going to press, the Department of Public Health put up an EMF page on the state's radiation control website that basically said, there's nothing to look at here. And I was just dumbfounded. So you can go out and look at that as well. So I was presenting to our state level Department of Education at the time as well. And mind you, our fact sheets never came out. And so I sat down next to the former interim commissioner of education in Massachusetts. And I said, so are you guys going to do anything to protect the kids? And he said, well, we're waiting for higher authorities. And I said, well, who does the Department of Public Health report to? And he said, the Secretary of Health and Human Services. So I called a meeting with legislative personnel. I called a meeting with Health and Human Services. I brought in the Department of Education, and we brought in a half a dozen citizens from across the Commonwealth of Massachusetts in what I thought was a really good meeting. And then still, nothing happened to protect the public. We have also given presentations to the Department of Public Utilities because the industry keeps trying to force those toxic utility smart meters into our homes. And we have had audience with the Attorney General's office during those hearings. And so the lessons that I've learned that I'd like to share with you is that as healthcare professionals, you carry weight. When you join your patients and the constituents and go in and talk to the legislative bodies on this and the other agencies that make decisions, you carry weight. So please, I know our plates are so full already, but if you can engage and help the advocates in your area or spearhead initiatives, that would be extremely helpful. And don't go it alone. Every time I thought that I would raise my hand and say, we have a very serious issue here, and I anticipated that they would do what New Hampshire did and fix the problem, or at least begin addressing it. Every time, if it was just one voice, it would get swept under the rug. So please educate those around you first, get a groundswell, and then go start talking to the authorities. And if you can, invest in a radio frequency detection meter, because this invisible toxin is far too easy to dismiss because nobody has ever known it's there. And then go in as a group, provide information for your public servants. You know, I try to put myself in the shoes of the people who are in a position to affect change. So in my research repository, I have created a page for municipal leaders. What are they hearing from the industry? Why do they not know about this? And walk them through all of that and show them what the actual science is saying. And then understand what their systems are. How does change happen from where they are? What hurdles do they need to leap over? And see if we can help remove some of those barriers. And we can't expect someone else to fix this. We have to keep the process moving. And then collaboratively, let's transition our homes, our schools, our healthcare practices to hardwired, safe technology solutions. And, you know, at this point, the conversation is great because we have so many tools. I can be engaged to come in and do community conversations. We have this off-the-shelf training from Wireless Education for both schools and the workplace. And there's an information card that you can get printed up to give it out in your practice if you would find that helpful. And then there's this award-winning film, Generation Zapped. And then, as Doug Wood will tell us, 5G Crisis has lists of groups that are already formed all over the United States. And if there's not already a group in your area, they have a wonderful toolkit to help you get that started. So please take advantage of the resources that are out there. And I thank you so much for coming to this conference and for coming to this session in particular to learn about what's happening around the United States at the state and local level. So thank you. If you want to find me, you can find me through wirelesseducation.org. You can also go to Massachusetts for Safe Technology. And folks in California just modeled California for Safe Technology off of this website. So if that's something we could help with, we'd be honored to do that too. And you can certainly email at Massachusetts or MA4 safetech@gmail.com. Thank you so much for your time and consideration.